I think one of the questions people want to ask me, or um, sometimes ask me directly, in fact, is, what is a woman uh, doing fighting for the health equity of boys and men of color and leading the nation in this effort, And I am often less annoyed than I used to be by the question, because I realize that that question comes from this place of not being fully aware of all the ways in which Black women have served and supported and forwarded, advanced, if you will, movements around health equity and justice. I mean, we have been caring for boys and men of color for generations, starting with the salves we used on Southern plantations. So I don't think it's a novel thing for me to be here, while I appreciate that people might perceive it as such. I also feel like that question is linked to an even deeper one that folks might have, and that's, why are we focused at all on boys and men of color? And why are you the person doing it? I feel sometimes like my women's health colleagues look at me quizzically, like you're fighting for the enemy, like you've gone to the dark side. But I quickly remind them of how linked our fates are. I quickly remind them that to create a truly gender equitable world, that we cannot ignore all the ways that patriarchy has shaped both the lives and the possibilities for opportunity for women and girls, but also for boys and men, and particularly boys and men of color operating at the margins of society. I think that if we were to have an honest conversation, we would be able to see pretty quickly that the so-called, socioeconomic advantage that males have does not extend itself to boys and men of color. That in fact, across a number of indicators, we see lower access to opportunities for upward social mobility for boys and men of color than we do for women and girls. And that's just something we have to name. You have to call a thing if you're going to really grapple with it and produce good solutions. And so I often remind them that when we look at certain health data and outcomes, we can easily see that boys and men of color are perishing from conditions that are, amenable to prevention and treatment if they're found early, far more than women. And I hate using the less more, approach, because I think that kind of equation always equals mathematics that leave some person winning and some person losing. And this is not a zero-sum game. In fact, when boys and men of color perish before they're able to reach their fullest potential, the women and girls they leave behind are almost always deeply, deeply affected. And so I just wish the conversation around these issues were a little bit more nuanced and also honest about the roles that we play in each other's health and well-being. And so I do this work unapologetically because, I don't have time really to stop and ask people questions or permission to be in the space. I mean, if I did that, then the work wouldn't get done, at least my part in the work, because I recognize that also that I play a really small role, almost like the key maker in the Matrix, where his role is to just go and open the door. So I'm opening the door, and sometimes I'm like Hodor in Game of Thrones, and I'm holding the door. But whatever that role is, I intend to play it, and to do it to the best of my ability, because I believe in the possibilities that lie in the untapped potential of boys and men of color, and by that extension, in communities of color. So I work to advance health equity for boys and men of color because I believe that I have a unique role to play here. And I also believe that if we can do this work and do it well, that we will in fact be a better society.